Hello and very warm welcome to the Canada News with your host Gurdwara. Now let's take a look on the headlines. Toronto police team tasked with the enforcing stay-at-home order laid to 30 charges on first week of operation. Haidu says Canada will come up with a certification to allow COVID-clear Canadians to travel again. Hospitalizations, ICU admissions growing for younger Canadians in third wave. Now news in detail. The Toronto police team tasked with responding to large gatherings that violate Ontarians' lockdown measures have attended more than 300 incidents and laid over 200 charges in their first week of operation. Police said the enforcement teams were launched on April 22 to make sure people follow the provisional government's tightened stay-at-home order. Officers from the 16 divisional teams across the city have since attended 315 incidents, including 105 calls reporting gatherings. Toronto police said in a statement that this resulted in 230 charges laid under the Emergency Management and Civil Protection Act. The new emergency order, which was imposed on April 8 for 4 weeks, has been extended until May 20. Health Minister Patty Haidu says her government embraces the concept of vaccine passports and will come up with a form of certification to allow vaccinated Canadians to travel internationally again. Canadians are going to want to travel, and just like there have been changes in other kinds of travel requirements over the years as a result of number of events, Canadians need to be prepared to be able to travel internationally as countries make progress on the COVID vaccine rollout. A debate is heating up over how to revive the international travel sector that was flattened by the global pandemic. That discussion has focused on the idea of digital passport or vaccine certificate that would allow citizens of one country to prove the border officials in other countries that they are fully vaccinated or have tested negative for the virus. High vaccination rates among seniors and more infection variants of COVID are shifting the weight of pandemic in Canada to younger people. An analysis of data published online by Health Canada suggests far fewer seniors ended up in hospital with COVID in April than during the second wave peak in January. But among people under 60, hospitalizations and ICU admissions went way up. Chief Public Health Officer Dr. Theresa Tam has said from the beginning of the pandemic that COVID is riskier for the elderly, but it can and does strike down the young as well. Now with variants of COVID-19 spreading more easily, more people are getting infected, and the still rare severe outcomes for the young are happening more often. A coalition of education workers, doctors, parents and community activists came together in Mississauga to demand the Ford government to do more to help Peel region, as there were 95,043 total cases of COVID in Peel region, with Brampton accounting for almost 60% of those infections. The group gathered outside the Peel Public Health Building to voice their demands, which include higher priority access to vaccines and additional support for essential workers, including 10 paid sick days. The Ford government unveiled its sick leave plan, which only provides 3 days of paid support. The program, which will be delivered through the Workplace Safety and Insurance Board, will see employers pay employees both full and part-time up to $200 per day for 3 days. Health officials reported 3,369 new infections, a drop from the 3,887 the previous day. Toronto had the most cases with 1,050, followed by 819 in Peel region, 286 in New York region and 158 in Ottawa. Another people 29 died as a result of the virus, raising the death toll to 8,079. The province recorded a positivity rate of 7.3% as just under 47,000 tests were completed in the past 24 hours. There are now 900 people in the intensive care units. Of those patients, 637 are on the ventilators, an increase from the 632. The number of people being treated in the hospital overall fell to 2,152. COVID vaccine were administered and more than 3,73,000 Ontarians have been fully vaccinated. Protesters, most not wearing masks, gather in Montreal to demonstrate against Quebec public health restrictions such as a curfew. They were calling for a return to normal life with the economy fully open and people allowed to gather as they once did without fear of police knocking on the door to issue fines or illegal gatherings. A large group marched a loop around Massinova Park halfway through. People here are ready. They are responsible. They want their freedom back. According to Montreal Police spokesperson Manuel Court, the protest was peacefully overall. However, he said there were several dozens interventions for non-compliance with health measures and some arrests for obstructing the work of police officers. Alberta reported record high COVID cases, surpassing 2,000 new cases for the third consecutive day. Provisional data shows 2,433 new cases were confirmed within the last 24 hours. Of these, 1,743 were variants. Active cases rose to 22,504 across the province, of which nearly 70% were in the two health zones, encompassing Alberta's two largest cities. 6,065 were in the Edmonton zone and 9,423 were in the Calgary zone. Alberta has the highest rate of active COVID cases of any Canadian province or territory. New health rules came into effect for hotspots that would move grades online and shut down indoor fitness. Provincial data shows 2,433 new cases were confirmed within the last 24 hours. Nova Scotia is reporting 148 new cases of COVID today, with the majority of new infections in the province's central zone. The figure marks a single-day high for new cases in the province, but Premier Ian Rankin says the large number of cases was expected as Nova Scotia Health Authority lab catches up with a backlog caused by high testing volumes. Nova Scotia has 713 active cases of COVID in the province, with 30 people in hospital, including 5 in intensive care. The leader of opposition in the Ontario Legislative Assembly, Andrea Howitt, raised the issue of Auditor General Long-Term Care Inquiry Report, where he called for accountability and reform. In response, the Minister of State said the responsibility falls on him and every step has been taken by the government, and further improvements will be made based on the Auditor General's report.
I would normally go to the Premier, but he's on his 10th paid sick day today, so I'm going to go to the Deputy Premier with my first question. Yesterday, the Auditor confirmed that seniors in long-term care were abandoned to COVID-19, and we all saw the horrifying tragedy that ensued as a result. The Minister yesterday refused to take any responsibility whatsoever, and went on, in fact, in her press conference, to blame everybody that she possibly could, including the Minister of Health. Speaker, the Minister of Long-Term Care has now had 24 hours to reflect on her response to the AG's report yesterday. My question would be, is it still her claim that neither she nor this government will take any responsibility or takes any responsibility for the tragedies that unfolded in our long-term care system with COVID-19?
Minister of Long-Term Care.
Thank you, Speaker, and thank you to the member opposite for the opportunity to clarify. As I said yesterday, and have said repeatedly, I take responsibility. I have a duty and an obligation to residents, their families and staff in long-term care. And I have been absolutely consistent with that messaging. So I don't know why that wasn't heard yesterday. I want to thank the Auditor General and her office for her special report on long-term care. And she was very clear and very insightful that it is the long-standing issues in staffing and the lack of new development and redevelopment of existing long-term care spaces that contributed to the spread of COVID-19. And I had a very long discussion with the Auditor General on Monday, which I appreciated very, very much. We will take extensive and ongoing measures to protect the health and safety and well-being of residents. The $4.9 billion that is going to create 27,000 new staff for long-term care on top of the 8,600 and more that we created during the first wave and into the second wave. We'll continue to take measures to shore up a sorely neglected sector.
The issue of small businesses was raised by the NDP MPP from Parkdale High Park. who said that his riding-related businessman applied for an emergency grant in January, which was received in March. Responding to this, the Associate Minister of the Department of Pravneet Sarkaria said that the government has helped 1,70,000 businesses.
David owns a home decor business in my riding. He applied for the Ontario Small Business Support Grant in January and was approved on March 14th, but he has yet to receive a dime. Sandra Lee owns a photography business and was approved for funding on March 7th. More than 50 days later, she's still waiting for payment. And the government is not responding to their emails or phone calls. Small business owners have been locked down for months. They will go bankrupt without this support. My question to the Deputy Premier is simple. When will the small businesses get the funding you approved?
The Associate Minister for Small Business and Red Tape Reduction.
Thank you very much, Mr. Speaker, and thank you to the member opposite for bringing that forward. We are working around the clock. We have hired over 100 extra individuals to support and ensure that businesses get the money that they need. We recognize this is a significantly difficult time for them. To date, we have processed over 107,000 payments directly through the first phase of the program, totaling $1.5 billion. 57,000 businesses have also received a second automatic payment of that fund as well, totaling another $850 million. So over $2.4 billion in direct supports have gone to these businesses. We recognize that there are still some challenges. We are working through those, and we're going to make sure that those businesses get the money as soon as possible, because we do understand that this is a very challenging time, and we're happy to look into those and support the member.
Supplementary.
Speaker, this minister has no clue of the reality on the ground. So many small businesses are having problems with this program. Steve owns a moving company. He was told to upload his financial documents, but the link he was sent doesn't work. He has called and emailed and can't get a response. Small business owners like Steve are trying to survive the pandemic. They need support now, not in weeks or months. They need an application system that works. When you promise something, you have to deliver it, or you're just wasting people's time and putting them through hell.
Ontario Premier Doug Ford has once again called for the closure of Toronto Pearson Airport and tightening the U.S. border, saying more cases in the province are related to variants and a case involving an Indian variant has been found. According to Ford, he has asked the Prime Minister to take more drastic steps during the talks.
We could one day soon face a variant that is resistant to our vaccines, because we're learning about our terrifying new variants every single week. And sadly, not enough is being done to keep these deadly variants out of Canada. Last week, the new Indian variant was reported here in Ontario, and it didn't swim here, I can tell you that. In fact, we learned yesterday that 90% of average daily cases this week are variants of concern. The same variants that fueled our devastating third wave, and they got in because of weak border measures. I can't stress this enough. We will never get ahead of this virus if we can't keep these deadly new variants out of our country. The borders, land and air, they're federal jurisdiction. And I assure you, if I had the power, I would close down Pearson Airport immediately. I would shut down the land border crossings to only those who are absolutely essential, because I would do everything in my power to stop a vaccine-resistant variant from getting into our country and bringing a fourth wave with it. Last night, I was on a call with my fellow premiers and the Prime Minister. I once again pleaded with them to do more, to tighten the airports, to bring in mandatory pre-departure testing for those flying into Ontario from other provinces. And most importantly, to close the massive loopholes at our land border with the United States by bringing in a mandatory hotel quarantine for those major land crossings. Because too many people are exploiting these weak measures at our land border to get around the hotel quarantine. I want to thank our incredible border protection officers. These people are true heroes. They're doing everything in their power to keep our country safe, and I fully support them.
During a meeting with the Prime Minister Justin Trudeau, the premiers called for a halt to international travel. According to Prime Minister Trudeau, the government is also considering the entry of international students, and so far 95% of travel has been stopped. Residents and Canadian citizens are returning to their country.
I think that is something that we've demonstrated from the very beginning. We had conversations around a range of issues that we could move forward on last night. I think one of the things to remember, first and foremost, on international travel and people arriving in Canada is it's been well over a year that we actually shut down over 95% of all travel to Canada. The only people traveling across our border in any way right now are either permanent citizens or Canadians returning home, essential workers, and a limited number of exception cases that have squashed the number down to 5% of what it used to be in previous years. On top of that, everyone arriving in the country needs to show up with a negative PCR test from the last 72 hours, gets tested on arrival, goes into a strict quarantine for 2 weeks, in a secure quarantine location, usually their home, with significant follow-ups and checks, and has to do a third test on day 8 to ensure that they're negative. These are measures that apply to everyone. And one of the things to remember as well is there is a fundamental difference between someone arriving at our land border versus someone arriving at an airport. Someone who arrives at our land border has been in the United States, has a PCR test from the U.S., even if they traveled internationally before because of U.S. quarantines, has been in the U.S. at least 2 weeks. And therefore, the measures that we put in place at the border, and we're following very closely the numbers and the data we collect on these tests, has been an extremely low and manageable number of cases, and we're always looking at doing more enforcement, at stepping up on the penalties on that, and we will continue to work with the provinces on that. But there is a fundamental difference between someone arriving on connecting flights from anywhere around the world at our airports, which is why we have required government-approved accommodations until the negative PCR test that they got on arrival.
So that's all we have in this edition. Thanks for watching. Stay tuned for more updated news.